welcome. I'm Dr. Gonzalez, and today in this video we're talking about the following topics. The urinary system consists of the kidneys and the urinary tract, which are the ureters, the urinary bladder, and the urethra. The main purpose of the kidneys is to produce urine associated with the nephrons, and the main purpose of the urinary tract is to transport and store urine. Kidneys are going to be located at the posterior abdominal wall between vertebrae T11 and L2. And fun fact, one of your kidneys is slightly lower, positioned lower in the abdominal cavity than the other. This is because of the location of the liver and of urine. Your urinary system functions include the regulation of plasma ion concentrations, the regulation of blood volume and blood pressure. It also helps stabilize blood pH, and it prevents the loss of valuable nutrients. It also helps with the elimination of metabolic cell waste, and it synthesizes calcitriol, which is the active form of vitamin D, and it synthesizes erythropoietin for red blood cell production. Last but not least, it also aids in the liver with some of its metabolic function, and of course produces urine. The kidneys are protected by 3 layers of connective tissue that basically are the fibrous capsule, and it also contains a perirenal fat capsule and a renal fascia. Also, the kidneys consists of a renal cortex, a renal medulla, which dipped to the cortex, and it consists of renal pyramids, renal papilla, and renal columns. The kidney lobe consists of not only the renal pyramid, which is basically overlying the renal cortex and it's adjacent to renal columns, but it also consists of renal pelvis, which comprises most of the renal sinus, and it also consists of a minor calyx and a major calyx. Finally, in that, when the minor calyx becomes major calyx, eventually it transforms into a renal pelvis. This area right here, we know it as the hilum, and eventually it becomes the ureter. Okay, so now it's time for a short discussion break. The blood supply to the kidneys begins with blood in the renal arteries, and it continues flowing in the following way. Starting with the renal artery, then segmental artery, interlobar, arcuate, cortical radiate, and afferent arteriole. At this point, we are closer to the glomerulus in the nephrons. Then the afferent, from the afferent to the glomerulus to the efferent arteriole, towards the peritubular capillaries, and at this point we go back into venules, cortical radiate vein, arcuate vein, interlobar vein, and then back to the renal vein over the abdomen. Now let's talk about the nephrons and the collective system. So typically we have 2 main types of nephrons: cortical nephrons and juxtamedullary nephrons. The cortical nephrons, basically we have 85% of our nephrons are in the cortex, which is this area right here. and they have a relatively short nephron loop. In the case of the juxtamedullary nephrons, 50% of the nephrons are this type, and the capsule is located near the border of the cortex and the medulla, and they have a very long nephron, so they're located in between cortex and the medulla. Now let's go over the nephrons. And in the case of the nephrons, each nephron consists of a renal corpuscle and a renal tubule. The renal corpuscle consists of glomerular capillaries, or the glomerulus, and a glomerular capsule. The glomerular filtrate leaves the glomerular capillaries and it enters the glomerular capsule towards this direction. And then the afferent arteriole and efferent arteriole are part of the vascular pool. So efferent and afferent arterioles. The nephron and the collective system also consist of renal tubules. Particularly, we're going to have a proximal convoluted tubule, a nephron loop, and a distal convoluted tubule, for short DCT and PCT. The filtrate from the DCT then empties into the collective system, particularly connecting tubules from several nephrons that lead to a common collecting duct. And then the collecting duct passes through the renal pyramids and eventually it goes towards the minor calyx. The glomerular capsule, it's also known as the Bowman's capsule, and the glomerular capillaries, like I said, the glomerulus. And that's it for the nephrons.
Well, that's it for this video. I hope you like it. Don't forget to subscribe, like, and share, and also comment if you have any questions or suggestions about this topic. And also, if you like this shirt, it's now available on my Etsy shop, Queen Mary Anatomy. That's it for today. Thank you for watching. I'll see you next time.